and welcome back to our educational series here at the School of Public Health and Health Policy. Today's webinar is Boosting Our Communities Back to School Vaccinations, and we have a great webinar set up for you today. Speaking today is Dr. George Dawson, along with Marlene Taylor and Ensley Hobbs from our school, who will be sharing the schedules around vaccines, what we should be looking for, and what next steps are. So just a little housekeeping. Using the Q&A function today, you'll see if you take your indicator and move it around, the toolbar will come up at the bottom. If you have a question that you haven't submitted already, please feel free to actually click the Q&A so that pop-up menu will come up and you will be able to put your question in the chat box. The questions are anonymous, so the only ones that will get to see them will be the actual presenters. If we don't answer all of your questions today, we'll do our best to be able to share those answers with you in our thank you email. You should also know that this webinar is being recorded and will live on the City University, the Graduate School of Public Health and Health Policies YouTube channel. And you will be eligible for continuing education credits if you follow the information, and we'll be sure to post that. Want to take a really quick opportunity to thank our partners this morning. Ryan Health, as always, providing medical services and support and education in our community. So thank you to Ryan. The Center for Immigration and Refugee and Global Health. Thank you, Ensley, for supporting us and being a part. We have a new partner joining us, is the Pandemic Response Institute, which is looking at the issues related to pandemics and how do we best ensure that the next set of pandemics, we are better prepared to support our community. Our community partner today is Can't Be Silenced, Maria Davis, and thank you for your continued support. And most of all, want to take an opportunity to thank the team at the Harlem Health Initiative for putting this presentation together. You'll see on the screen is the webinar agenda. Ryan Health will be discussing with Dr. Dawson. He is our vaccine champion, and we are super excited that he is joining us again today. Plus Marlene Taylor, who is, what can I say? She has been a support to us in the community, not only around HIV, but all things medical, and helping us to always make sure that our information is correct and is culturally competent and is able to be delivered in a way that is supportive of our community. So thank you, Marlene, for taking the time to join us today. After you hear from Marlene, you will also hear from the Center of Immigration, Refugee, and Global Health, Ensley Hobbs, who will also share resources regarding our new New Yorkers and the organizations that they'll be able to link to. We'll move into a Q&A period and then quick takeaways. What will come up next will be a brief survey. So we ask that you please take a few minutes to just answer the quick 4 questions so that, again, we know who's with us and how best we can move our programming for the fall season. So, Dr. Dawson, I will decrease so that you can increase and share your knowledge. And once again, thank you again for always agreeing to be our vaccine champion and making sure that we are keeping our families and our staff safe. So thank you all, and I will see you on the other side of this webinar.
Thank you. So would you like me to get started?
Yes, sir.
Okay, thank you. I guess pointed out by Ms. Levine, I'm Dr. Dawson, and I'm a Ryan Health. I'm a vaccine champion in that I retired from medicine in the latter half of 2020 as a result of COVID, and recovered enough to resume my work in the sphere of public health and community health working aspects. And so I was with the DOH for a while, and then I was subsequently deployed to Ryan Health, and I've been here since 2021, and designated the vaccine champion, where I am involved in vaccine outreach, COVID-19, flu, Mpox, and the such. And so, am I in control of the deck, or
No,
someone
sir,
else?
we have it. Just let us know. We'll
Oh,
stay
can I
there.
get the next? Okay, can I get the next slide, and I'll just move right on. The next slide, please. So I've been given an agenda to talk about the different vaccines, and I just want to say my basic version of a vaccine is that how does a vaccine work? Well, vaccines work by tricking our immune system, and every one of us born with immune system. Most work, sometimes they don't work like we want them to. But the point of the immune system is to trick the body into thinking that a particular bug in our body doesn't belong there. And as a result of that, our bodies respond to that with something called white blood cells. All right. And those white blood cells do two things. First, they identify what that item is, what that bug is, virus, bacteria, what have you, or chemical. And then another set of blood cells, white blood cells called B cells, produce antibodies for that. Now, there are memory white blood cells and antibody producing white blood cells. And those antibodies are produced to kill the particular virus or bug. And so how does this go? So as the body processes this particular bug or piece of organism, we get that organism and produce pieces of it or the whole bacteria either killed or alive in a laboratory. And from that laboratory experience, we can produce millions of viral particles that will subsequently result in a vaccine. Now, years ago, when it first started, the vaccines were called live vaccines, and they had some risks to them in that they could cause a disease issue if you had a low immune system, for whatever reason, what we call immunosuppression. However, for most folks, those viral particles are in the form of vaccines, produce antibodies, but doesn't make you sick. Those antibodies, however, fight the next time that particular bug or virus or bacteria comes into the body. And so once that happens, and then you're, quote, protected, you could either be for life or it could be for a few months, as in the new type of virus vaccines we use called the messenger RNA vaccine. In my experience, the viral vaccines with parts of the virus tend to be more enduring, whereas the newer messenger RNA vaccines tend to be less enduring. But some of the viral vaccines can go for years, but so far the messenger RNA vaccine is durable for 3, 4, 6 months, depending on who you listen to. And so that's how that works. Next slide, please. So the first thing I want to talk about, I was asked to talk a little something about bird flu. And it's a big thing now in the news, bird flu. As you know, for the past 4 to 5 years, it's been infecting chickens on farms in the United States, and it has an effect on the actual chickens, because once you find bird flu in chickens, particularly in those large factory farms, you'd have to cull the whole lot to prevent its spread. And they've killed tens of millions of chickens, which may have in part been a cause of the rise in chicken prices. Further, because vaccines are made by parts of egg yolks and the like, because so many chickens were killed, we were worried that there wouldn't be enough eggs to grow vaccines. Of course, that's not happened yet. And because we're using the messenger RNA, which is not egg type growth required. It's basically a chemical concoction of the spike protein of the COVID virus. And so we really have bypassed that disaster, I hope. In addition, there are bird flu vaccines that are on stock now, and I'll go over that later, that we have them in stockpile, and I'll go over that later. So when did we first notice this bird flu? Well, it was first noticed in Italy in 1898, where it was called fowl flu. And that was a name that was in parlance at that time. As you see in the photo here, these are some of the wildlife animals or birds or avians that are have been impacted by bird flu: chickens, turkeys, geese, swans, ducks, and more recently we've seen cats and dairy herds. But the term bird flu comes from its scientific name, avian flu, which is a type A virus. And the type A virus are the viruses that are more likely to cause pandemics. But there are 4 types of virus: A, B, C, and D. And type A is the most common type to cause it, and type B is second most common. And when we get our yearly flu virus, they're both A and B. This year, it's a 2A type and 1B type, but typically it's what they call quadrivalent viruses. And so I want to revert back to the dairy cattle. In the United States, within the past year, there have been a number of dairy herds affected by bird flu. And in addition to that, there have been farm workers as well. And I want to go over that with you. Can I get the next slide, please? So could bird flu become the next pandemic? Some people thought that, because the particular type of bird flu out is now called the HPAI, and that's the highly pathogenic avian influenza, H5N1, and it's been reported in 23 countries since 1997. What does it do? It typically results in severe pneumonia and death in 50% of the cases so far. Fortunately, in the United States, we haven't seen that serious or extent of illness that we know of. In the US, there's been 9 confirmed cases in humans and no deaths so far. And they're typically in the United States affect farm workers, migrant farm workers who work with the dairy cattle. And scientists, as we know now, are developing messenger RNA vaccines so that they will be available if and when they are to become useful. One thing I wanted to put in everyone's mind is if you see sick birds in New York City, stay away from them. If you would like to try to protect yourself and your family, if you see any sick birds, stay away from them, because this virus has been found in New York City, and particularly in Harlem and the Marcus Garvey Park in Harlem. It was found, I think, this past year. And if I can get to the next slide, I can. Talk about that. So what happens is the professionals are recommending that everyone get a flu shot. Now, it doesn't protect you from bird flu, but the annual flu shot does produce less severe illness if you should contract bird flu. In addition, if you're handling raw chicken or meats, it's recommended that you wash your hands afterwards all the time, and cook your eggs and chicken well done, so to speak. And as I pointed out earlier, there has the bird flu been found in New York City in all 5 boroughs. And there's a wonderful paper from the scientists at Mount Sinai, who I think talked about this a month or 2 ago at the New York Academy of Medicine about what they found in their study, which is published, concerning bird flu in New York City. And these are the farms where the bird flu has been diagnosed: 192 total cattle herd in 13 different states. And again, the people who are most at risk now are farm workers and the cats on those farms. And they found out on the cats on those farms that 50% of those die from bird flu once they're infected. And so they were wondering, well, how did they get it? What happened? Well, some drink the raw milk, and that's the reason why they say What happens is bird flu affects the mammary glands of the cow where the milk is produced. And they're sort of telling folks to not drink unpasteurized milk because there are a lot of viral particles, and there are many reports within the past 6 months to let people know that you shouldn't drink unpasteurized milk at this particular time because of the bird flu viral particles within it. Let's stop responding. Hmm. So is there a bird flu vaccine? Yes. Now there are two types, and they're the older form where it usually takes 5 to 6 years to get these particular type vaccines, where they grow viral particles on eggs or egg yolks, and so it takes 6 to 10 years to get a relevant vaccine to work. And so we have at least 100 million doses on being stockpiled, and they can be shipped out to within the public within 2 to 3 months. So that each dose of vaccine, it requires for people 2 doses. So that means that we can cover 50 million Americans at this particular time. And there are 2 messenger RNA vaccines on the way. So there is it's not all lost, so to speak, that we do have some vaccines available in stockpile, and people are currently developing 2 messenger RNA vaccines. Next slide, please. So when should you get a flu shot? You can see that you hardly see flu cases in October, November. However, you do see them in December, January, February, and March. And so I like to tell folks, if you're going to get a flu shot, unless you have particular illness or you're a young child and not have an intact immune system, then you should hold off getting your flu shot until October, early November for sure. And then you'll be probably covered during the most opportune time for flu to spread among our population, December, January, February. And that's what this slide represents. Next slide, please. Chickenpox. Chickenpox was eliminated basically in 1995 with what they call the chickenpox vaccine program. And so in my young years, when one was to get chickenpox, we would have what they call chickenpox parties because there wasn't a vaccine then. And that way you can get exposed to it and get it over with, because it could be pretty miserable with all of the skin lesions and the like. However, because of the vaccine program, chickenpox in the United States declined by 95%. And so chickenpox is considered a vaccine preventable program. Next slide, please. And one other thing about chickenpox, in our later years, senior years, such as myself, some of us can get what we call shingles. And that's a very painful disease that can affect your nerves in our body. And you'll see some people get severe sores and chronic pain from the shingles. And now for seniors like myself, they recommend that we get Shinglex or shingle vaccine now. So in addition to the chickenpox vaccine for our young people, there are a so-called chickenpox vaccine for our old people. Thank you. And the next disease that's a vaccine preventable is diphtheria. You can see this is a piece I got from the Daily Mail. And you can see before vaccine in 1942, there were hundreds of thousands of diphtheria cases. And the word diphtheria is French for leather-like. And that's because of the bacteria. It's a bacteria, not a virus, because in the throat, you can form a leathery-like substance. It's almost like Canada, but much worse, much thicker. And so it's called a diphtheria in that way. And it can have serious complications from it. And because of vaccines, you can see how it has declined significantly. Next slide, please. Again, it's a vaccine preventable illness, and in the form of a bacteria, not a virus. Where is diphtheria most? It's largely found in Haiti and DR as it is now, in Asia, Eastern Europe, and Middle East, in significant numbers where it causes a lot of morbidity, particularly in young people. Next slide, please. Whooping cough. otherwise known as pertussis. That's a highly contagious respiratory tract infection. You get severe coughing, coughing spasms to the point to where you can break your ribs. And at the end of it, you have this high pitch, you're trying to breathe. I don't know if you heard of asthma, when you're trying to take in breath, it's a, you know, and so it's a whooping cough. So you have spasmodic coughs and then this whoop at the end of it. And it's a very serious illness, and it's a part of the vaccine regimen called DPT or TDP, Tdap and DDAP. And the P is for the pertussis part of it. And so, I mean, a lot of our young folks who get it, it particularly affects young people who are too young to get the vaccine, or older people and adults whose immunity has faded over time. Next slide. So who should get the whooping cough vaccine? It could be either Tdap for those kids who are less than 6 years or less, and for Tdap, which is you notice that the D and the P are small letters. That means that it's less of a dose. For preteens, this Tdap is like a booster, so to speak. So the first strong regimen is when the first 6 years of life or so. After that, you get the so-called boost dose. And what else is Tdap? Tdap is good for pregnant women because in the first 6 months of a baby's life, their immune system is not functioning to the extent as it would, say, when they're 5 years old. And so, as you know, with COVID or any other disease, if a woman is not vaccinated particularly, then that baby's going to have a lot of trouble, whether it's COVID or whooping cough or whatever. And for any adult who hasn't had it in a while, may be exposed to it, or in places where it is local, you can probably get a booster shot yourself of the Tdap. Next slide, please. Polio virus. There are 3 types of virus. There's no cross protection with the vaccine, and it only affects human. Back in the day, long ago, we used to use the oral polio vaccine. That is, you take it by mouth, and it would protect your guts or your intestines, and you'd poop it out. And when you poop it out, you provide protection to people around you, because it's not the real virus. It's a weakened version of the virus, so to speak. In the United States, we use a different type now. It's called the IP, or the inactivated type virus, kill virus. But we cannot use the oral virus in the United States anymore. And whenever there's an outbreak here, it's because someone has come from another country who has been given oral vaccine. And because they do, as I point out, poop out some viral particles, people who are with a low immunity or not vaccinated, which is rare in the US, can contract forms of polio. What is so crazy about polio? Well, it affects the spinal cord, and that's where you hear the word poliomyelitis. And not everybody gets it, as I point out there, but it is something. Back when I was young, in the 1950s, well, I wasn't young in the 50s. Well, okay, I was young, very young. In the 1950s, there was something called an iron lung, because what happens is the polio virus affects the motor neurons in our spinal cord, and that helps us moving our muscles, our diaphragm, and our ribs, and that's what causes us to breathe, in addition to a center in our brain. And so if you have paralysis of those muscles, then you can't breathe, and that requires a so-called iron lung. And I think there's a man who was the longest person ever living on an iron lung, just died within the last 2 years. And so thanks to the polio vaccine, that we don't need that anymore. And next slide, thank you. Now, COVID. Now, this COVID thing, the most important thing on this slide is where you see circled in red, where the hospitalization and deaths. So you can see that in terms of hospitalizations and death, it is seniors who are bearing the brunt, 65 and over, right? Look at the young people group at the top. This is New York City data, but these statistics are reflected across the country, if not globally. But I know it's reflected in our country. So you can see it hardly kills our young people unless they're less than what, 4 years old, because they don't have immunity, and particularly if the mom didn't get immunity while she was pregnant, which is why we recommend that the moms, if they're pregnant, to talk with their doctor and get their idea of what's going on, and then do some research. But anyway, the point is, if you live in an intergenerational house or multi-generation house with the seniors and the young people, you can see that COVID is, unless the young people have a particular underlying illness, they probably can withstand COVID like it's a cold or something. However, for older people in that house who are not vaccinated or have significant amounts of comorbidity, it can be devastating. And that's the point of this slide, that it is a senior disease that can result in hospitalization and lots of death. And so that's I push that hard, and that's why we cover so many senior centers and churches here in Harlem. We've done a lot of vaccination, and I'm very proud of the work that we all have done with the Department of Health and with Ryan Health and our other partners in the community. Next slide, please. Now, what about these updated COVID-19 boosters? So the 2023-2024 vaccine has not been able to cover the summer surge that we're seeing now. There's a lot of COVID now. I mean, a lot. And we really don't have a count on it because of what? Home testing, right? Unless you go to an ER or whatever, then it may get reported to the Department of Health. So they're mentioning how awful it is now in terms of this is the worst summer surge we've had, I think, since the pandemic. And so the reason is the vaccine from last year doesn't come with the newer flirt variants of the JN1.1 and KP.2 and 3 variants. However, you can get some protection in that they'll make you less ill. But everybody, I mean, it seems like everybody's getting COVID now. And so if you're a senior or you have existing illness, you should really get the new booster when it comes out, 2024-25 booster, which a lot of places are in right now. But that's the big thing. And if you're 6 months and older, you should really get that. And particularly if you have an existing medical condition or you're 65 and older, you can get the new vaccine, the 2025, within 1 month or two after your latest vaccine, or if you had COVID. Now, ordinarily, if you've had COVID, we say wait 3 months if you're a young, healthy person, because you have protecting antibodies, right? And so you don't really want to blunt the effect of the vaccine stimulation because now it's stimulated already because of the infection you've had. And so, but if you have an existing medical condition, immunosuppressed or whatever, and then we recommend you don't wait 2 months, all right? Just get it. And talk with your doctor right away. There's a new change in children. This is for the Moderna version, not the Pfizer version. For children 6 months to 4 years that are not vaccinated, they're going to require 2 of these new shots, the 2024 to 2025, 4 weeks apart. And you'll see when Mrs. Taylor goes over her work that the young people, that the school system is recommending that folks get it. The young people get it. All right, 0 to 6, whether you're in child care or whatever, they recommend that you get it. And if they've not been vaccinated before, it's 2 shots. If they've been vaccinated before, it's only 1 shot, right? No matter how many vaccines they've had, 1 or 6, it's only 1 updated version of the shot. All right. If you're 5 and up and you had, regardless of what you've had in the past, you should get that 1 new updated booster, because it's very crucial. Even if you've not been vaccinated, if you're 5 and up, you get you get 1 updated booster shot. But remember, that's different from the people who are 4 or younger. You get, if you've not been vaccinated, you get 2 shots a month apart. If you have been vaccinated, you get the updated version. And the Pfizer may be a little different in that they normally offer 3 shots. So it really, you got to make sure you talk to your doctor and get the right prescription for yourself. Next slide, please. COVID-19 in some children. There are groups of children who are particularly bothered by the virus. Those kids with history of chronic lung, heart, kidney disease, weakened immune system, cancer, organ transplant, sickle cell disease, diabetes, obesity. And when we looked at data from hospitalization from COVID back, I think it put a report about 2 years ago, and it pointed out that those kids who tend to be hospitalized with severe COVID were morbidly obese, kids of color who are not vaccinated and had other comorbidities. And so again, that points out the need for, particularly if you have an underlying illness, whether you're old or young, that you really need to protect yourself and your family by getting a vaccine. Further, they found out that kids with disabilities can be seriously hampered by COVID, particularly those with cerebral palsy, intellectual disability, autism, or at risk for severe disease. And you can call this number or go to this website, and they can help you with the resources to care for the particular children who may have special needs. Next slide, please. Long COVID in children. Well, we talk about it in adults, particularly older adults with all of the comorbidities older adults have. Well, for young kids, they can get long COVID as well. And there's a report just out in, I think, a JAMA network, and it talked about that young kids too can experience COVID. I think these kids were 6 and up, and just interesting that their symptoms were quite different from the adults. And so again, 2 reasons to get kids vaccinated. One is to protect those grandparents and those relatives with medical conditions, including themselves. And number 2 is to prevent the child, particularly if they have medical condition, from developing long COVID. Because it's not just an adult issue. Next slide, please. Other vaccine preventable diseases: measles, mumps, hepatitis A, B, and many more. And I got you a link right there, and it has a nice slideshow. You can go over and talk about that. Next slide, please. So you say, well, what about these vaccines? Are they really worth it? Well, this is new CDC data. It's in a medical journal, but I decided to use the New York Times as a reference. And it says, since 1994, childhood vaccines have prevented 11 million illnesses and 500,000 deaths, and probably hundreds of thousands, not million, the hospitalization. And so the vaccines are worth it. I know there's a lot of anti-vaccine propaganda out since the pandemic, which is really a sad state of affairs, but it is what it is, and we just have to work around it. And so just keep that in mind, that vaccines do work. Next slide, please. This is just from a Gallup poll, and it talked about Americans are less likely to say it's important for parents to have their children vaccinated. And this is really sad when you can see what it was in 2002, and since the pandemic, it's gone down, and it's more politically related, as the next slide will reflect. The Republicans are more likely to not favor childhood vaccine as opposed to Democratic voters. And I was thinking I would like to see independent voters surveyed and see their opinion. I imagine they're much higher than both groups, Democrat and Republicans. Next slide, please. The Silent Kid. This is a big thing we've been doing even up until yesterday for me. We're going to the public schools and we're vaccinating kids. And of course, they need a plethora of vaccines in light of what's going on in a lot of the countries. And so we're doing a lot of vaccine, DBT, MMR, measles, mumps, rubella, varicella, which is the chickenpox vaccine. And so we've been doing quite a bit of vaccines, and I put 2 nice references here for you to go over. We see people from Russia, Africa, China, some Eastern Europe, but I'd say 80–90% of the folks we see are Central and South America. And that goes with what we're seeing, you know, in terms of our newly arrived citizens. And so I think it's very important that our public schools require this, because occasionally in some of the shelters, you're seeing measles outbreak in Chicago and some here. And so it's very important that we get take care of our kids in school, particularly the asylum kid. Next slide, please. And hand hygiene. I'm going to close here. The most important thing you can do to help prevent COVID, in addition to the vaccine, is to know how to wash your hands. And that's after you use the restroom, before you eat, different scenarios. You got to wash your hands for 20 seconds with soap and water. And I like to count 1001, 1002, 1003, or sing happy birthday twice. And that'll be enough time to wash your hands. Again, you want to get up a good lather and with soap and water. And scientific studies have shown that that's the greatest way to minimize viruses and chemicals on your hands at this particular risky time. Next slide, please. Hand washing, you wet your hands with clean water, running water. It could be warm or hot. You could lather your hands, rubbing them together with the soap, fingernails. Do it for 20 seconds. Happy birthday twice, happy birthday twice. Rinse under clean water, and then dry your hands with air dry or towel. Now, what do you do when you walk? This is my pet peeve. What do you do when you now exit the bathroom? I usually grab a towel and open the door handle with that. So what's the point of washing if you're going to recontaminate them going out, right? And so just think about that. Be cognizant of where you're touching. I mean, I'm getting so that I'm afraid to touch handrail. I know it's paranoid, or doorknobs. So I know it's extremely paranoid, but I don't know. It's just me. You don't get to be 71 years old being carefree, right? So just think about that. Just think about that, what you're doing and how you can protect yourself. Next slide, please. Again, hand hygiene before, during, and after preparing foods, before and after eating, before caring for someone at home who is sick with vomiting or diarrhea, before and after treating wounds, after using the toilet for sure, changing diapers, blowing your nose or coughing. And I still see people coughing and then shaking somebody's hand. I think it's a deliberate human bioweapon when you do that. And so be very careful. Be careful with animal waste. Be careful with handling pet food and treats. And of course, touch each other. Just always be mindful of hand hygiene. Next slide, please. And well, that's it for me. And so I'm going to turn it over to my favorite colleague, Ms. Marlene Taylor, to knock it out. And I call her the co-mayor of Harlem. Mr. Charles Shorter is
Oh my gosh.
first mayor, and she's the second mayor. Co-mayors, right?
Oh
All
gosh.
right. Thank you very much, Ms. Marlene. Thank you.
Thank you. So I want to just again thank the Harlem Health Initiative, Deborah and Priya and your staff for allowing Dr. Dawson and I to present this very important information. It's an honor to present with our vaccine ambassador, Dr. George Dawson, who you heard and eloquently presented some vital information around vaccines. I'm going to present a lot of information and highlight from a primary care standpoint. I see patients who come in for routine primary care, and many times they have forms that need to be completed. So it's important for us to know as primary care providers what they need. They come along with at various points in their age group. And as you'll see in the schedules that I'm going to present, depending on where they are, there are different recommendations and guidelines. So again, thank you, Dr. Dawson, for putting this together. Another really important thing I want to make sure that you do is Dr. Dawson put together a lot of resources at the bottom of each slide. There's vital links and information that even after the talk, and I know Deborah and Priya, you said you would also forward this information as well. But those links are really important because what I'm going to present, when you click on them, it expands and shows the actual forms and resources that are important to understand. So next slide. So what do New York City schools require? We require children aged 2 months to 18 years of age entering or attending childcare, public school, or private school to be vaccinated against certain diseases. It's important not only for the student, but also the other students and the staff. When we look at it from that standpoint, I remember when my sons who are now 26 and 31, but if one child was sick, the next thing you know, over the next few days and weeks, all the other children would get exposed to these various viruses. So it's not only about what we need to do for our children, but the whole community as well. Within 14 days of the first day of school or daycare, a parent must show proof of their child's up-to-date vaccinations or provide a valid medical exemption from vaccination. So what does that mean and what does that look like in terms of being exempt? Next slide. Next slide. Can I control that or? Okay, there we go. So what is the vaccine list? All students from those in childcare through age 12. They must have, as you saw on Dr. Dawson's slide, the DTP, which is diphtheria, tetanus, and pertussis, which are viral infections that can be prevented. The polio virus, which you mentioned, in the early days, it was oral, now it's given an injection. The MMR, measles, mumps, and rubella, which many times I get people coming in, not only school age, but also adults who need it for work. If you're going to work in a hospital, or you're going to work in a school or work in a rehab center, they need to know, have you been vaccinated? And many times the forms have on it, not only the information about the vaccine dates, but when we get back the titers, we can see if they're protected or not. And if they haven't been, then we're able to give them the vaccine. So getting those titers is important, but again, the knowledge about have they been vaccinated or not, because those forms that many patients that come in who want to work as home care attendants or work as these days with patients with Medicaid, they can have a family member take care of them or assist them with their activities of daily living. But we want to make sure that they are protected from these diseases. Varicella, as Dr. Dawson mentioned, that haven't had chickenpox, and in the older age group, getting the Shingrix or protection from shingles. But just, again, these are viral illnesses that can be prevented. And of course, the hepatitis B virus. Next slide. And so what are the New York State requirements, the most current 2024 to 2025? If you orient yourself to the top of the slide, it shows for pre-K what's needed, Head Start and nursery, what's needed for kindergarten and through grades 1 through 5, and then middle school to high school, and then at grade 12. So again, going down the side, it's the DTP, it's the polio vaccine, the measles, mumps, and rubella, the hepatitis B vaccine, and that's a vaccine that's given the next month, and then 6 months from the initial dosage. The varicella vaccine, the first dose is given, again, pre-K, and then followed up with 2 doses. The meningococcal conjugate vaccine, again, for those pre-college, college-age students. I know for all of the universities and colleges, they need to have you go to a site and upload that documentation, because meningococcal infection is something that that age group is susceptible to, encephalitis or active infection with the meningococcal virus. So important that that's documented before they can start college. The Haemophilus influenza type B conjugate and the pneumococcal conjugate vaccine. Next slide. So how do you get your child's school record? It's a common challenge. A lot of times people are like, oh, I know in the old days we had those yellow forms, those yellow cards, and over time, of course, everything has become technologically savvy. So it's like people don't walk around with those, but they're actual sites that actually have a registry of those immunizations, thank God, because people just don't have those, years ago, that documentation. So there's an actual form which I've had to complete. It's the CH-205. It's a new admission exam form. And so it's a physical exam, but there's a lot of, again, when you click on the link, but you can even Google the CH-205 form, and it's a very comprehensive summary of questions and also the physical exam. And it'll also include documenting the vaccines. A printout is, as I mentioned, you're able to get that printout. It has to be signed by a doctor or nurse practitioner. The printed record can also be found in this registry with the Department of Health City Immunization Registry. So what a lot of electronic medical records do have at our disposal, which I'm really thankful for in Ryan, is we can go to this site that actually shows us the patient's history of their vaccines. Even if they don't have it, there's this documentation that's there. So you want to ask, and the takeaway of all this is always going to the primary care provider or the patient's pediatrician or adolescent medicine provider, because they most times have this information. But in addition to that, it is that registry. If you don't have a ID, the New York City card, you can go to My Vaccine Record and search for the child's records as well. Or you can always call 311. Next slide. And so what are the current guidelines? So every specialty in medicine has updated guidelines. It's basically a guide for how do we approach managing that patient's issue. So there are diabetic guidelines and cardiac guidelines and HIV guidelines. And even the new doctors right out of medical school, internship and residency, they have to adhere to these guidelines. And again, to emphasize, it's not like one size fits all. So always looking at the individual patient and making sure that if they have a primary care provider who knows them over time, they can tailor their treatment or management and of course vaccines to that specific patient. In this first part, the comprehensive physical exam and required immunization, this exam looks at, of course, their vital signs. It looks at their BMI. It incorporates their vision, hearing, and dental screening, in addition to, of course, their past medical history, and then a developmental assessment, as well as a nutrition evaluation. And again, the link at the bottom shows that form. Next slide. So the nice thing about Ryan, which I really appreciate, is having a lot of community partners and resources for following up with patients. This slide shows a list of those schools that we work with and have a lot of the, we partner with them. And as you see, Booker T. Washington, some are uptown, some are around our various Ryan sites. You know, we have Ryan Clinics 2 in Harlem, one on 97th Street. We also have 801, which is a women and children's center. We have one uptown in Wadsworth, and we have one on Ryan Chelsea on 46th, 47th, and I believe it's 9th Avenue, and then one in the Lower East Side, Ryan Nina. And so a lot of the schools that we partner with are in those neighborhoods. Next slide. And as I mentioned about the guidelines can change from year to year. A community, a group of experts get together and look at the trends and then determine if there needs to be a change in what the recommendations are for the upcoming year. So if we look at this, the vaccines for, again, DTP, polio, measles, mumps, and rubella, the hepatitis vaccine, H flu, pneumococcal, and influenza. Of course, that can be depending on the strain. The dosage is usually the same, but again, looking at whether or not a second dose is needed or not, depending on the child's age group. So again, the child care, the Head Start and pre-K, that group versus the once they start kindergarten and up to 12th grade, to the 12th grade, what the requirements are. And again, the link at the bottom is able to connect you with the current guidelines for 2024. Next slide. And so to be in full compliance, the New York State immunization requirements show what the catch-up is. A lot of times, as I mentioned, people come at different times throughout the course of their, depending on how old they are, if they've moved, of course, with the new students coming into the United States, like where are they in this scheduling? And what do you do if you don't know what they've gotten before, if there's no way to get that information? I know some patients who I've had from the Dominican Republic or other parts of the world where they just don't have that information. So how do we catch up? And what do we do that's safe and been shown to be effective? And most importantly, what do the schools accept? So this is a link, and this slide basically shows what you do when the patient comes in and where they are again, whether it's, you know, whether they're starting childcare, whether they're in kindergarten through middle school, and then from middle school up to grade 12. Next slide. And then, so what about the exemptions? Sometimes I get patients coming in and they're one of the anti-vaccine people, and they're like, well, my child needs to be exempt because they had a problem with their immune system, or they had a seizure. And if you look at this, basically, the following are not valid contraindications to any routine vaccine. If they've had an egg allergy, even if it's anaphylactic, which is the most severe type of allergic reaction, it's not a valid contraindication for getting those required vaccines, namely MMR, influenza, or any of the others. Autism in itself, or any place on the spectrum, is not a contraindication. Controlled seizures with or without medication is not a contraindication. Whether or not they have a mild cold, there are thousands of viruses out there. And, you know, we highlight the big ones of COVID, of course, flu, et cetera. But there are thousands of viruses that children get exposed to. And so coming in with a low-grade fever or having sniffles is not a reason not to get vaccinated. Patients who are immunosuppressed, does not mean that they don't get vaccinated. If anything, they need to get vaccinated. As you know, I specialize in HIV, and my patients definitely making sure that they adhere to their flu vaccine every year, their COVID vaccine. I will say that I've only over my 100, 200 patients that I've followed over 20, 25 years, I've only lost 3 to COVID, and those were patients who actually stopped taking their antiretroviral medications and were unsuppressed, meaning their viral load was not undetectable. So they were not protected and were susceptible to COVID. And it was actually at the height of the COVID epidemic back in 2020. The other patient had multiple comorbid conditions, which included morbid obesity as well as severe COPD. He was the second patient, but the vast majority, I made sure that they understood. So it wasn't just make sure you get the COVID vaccine. It's like, this is the information we have, this is what we're seeing, and this is why it's important for you to get the COVID vaccine and your other vaccines. Again, being pregnant is not, as Dr. Dawson mentioned in some of the earlier slides, that it doesn't mean you don't get vaccinated. You should get vaccinated because you're not only protecting yourself, but you're protecting the unborn child. Parental requests to delay or withhold vaccines should not be considered because they just will not be allowed in school. Next slide. And so what are those exemptions? So we said what things are not reasons why, but what are the ones that can be used to say they are exempt. So if someone is in the process of getting the vaccine, there's actually a grace period of 4 days to 30 days showing that, okay, we're in the midst of getting the vaccine. So that can be a reason why. The other thing is a serious reaction to the vaccines in the past, and that needs to be signed by an MD or DO. A note is required that actually documents that they did have this serious reaction. I know of one patient that I've had who was actually hospitalized as a result of a reaction to the vaccine, a vaccine that was actually hepatitis B in the past. And so getting that hospital record, attaching that to this form, which you see the link for, the exemption, there's a specific exemption form. So that type of detailed documentation is needed in order to say that someone is exempt from getting a vaccine. Next slide. And so are vaccines required for New York City schools? Yes, they are. And again, this important link, which is nyc.gov, goes into detail about wellness and immunizations and how, of course, we've prevented so many disease outbreaks because over time, we know that a lot of these diseases, diphtheria, pertussis, measles, mumps, rubella, there was a time in this country where those diseases were prevalent. And you can see by, again, one of the previous slides, where those diseases are very rare. And for those patients who do come in to the United States, who we may not have been vaccinated, we want to ensure that there are not tiny outbreaks, whether it's in a shelter or whether it's in a community where there may be the information about their vaccination history is key. So what happens, in those early years with these vaccinations? We talked about the fact that what they need to start school, but what should happen from birth with their pediatrician all the way up to 6 years old. This slide highlights what those vaccines are and what should happen from birth up to age 6. Again, we spoke about hepatitis B, the rotavirus, which is a horrible diarrhea that can happen in infants and young children if they have this virus. DTP we talked about, Haemophilus influenza, pneumococcal, and polio. And this shows specifically when those doses should be given. Next slide. And what about, again, the doses of these vaccines for COVID, influenza, measles, mumps, and rubella, the chickenpox vaccine, and hepatitis A? I remember a time when we didn't, actually my younger son, that's when the guidelines recommended that children get vaccinated. against chickenpox. But back in the 80s and very early 90s, we did not have that. And then the guidelines changed. So it's important to stay up to date with the CDC and any updates in guideline recommendations. And of course, we know COVID was not recommended, 10, 20 years ago, because the end of 2019, I remember specifically my first case of a patient with COVID, and we all know what that looked like. In Ryan, we had sort of like a setup center. When people came in symptomatic, they went under a tent and they were assessed, and some people went to the ER, some people we kept and worked up, and it was just such a time in medicine and healthcare, and we don't want that to happen again. So making sure that students are vaccinated is key. I know there's, again, a lot of hysteria around like their immune systems, but for those reasons alone, though, that's why they need to be vaccinated, because they're susceptible to this virus and many others. Next slide. Again, so this shows so we talked about up to 6 years, and now this is the recommended vaccines from 7 years to 18. Again, depending on their age group and where they are, these are the specific recommendations. If you look at the color code there, the dark purple are all children in age group should get the vaccine. The lighter lavender is some children should get the vaccine. And then the purple, all children in this age group can get the vaccine. And then the striped areas are parents and caregivers should talk to their healthcare provider. I want to just mention that for everything, you should always, again, having that historical information is the best possible resource for what to do. When many times I see patients, again, coming in, they are new to New York, or they just stop seeing their provider for various reasons. But getting that information either from the registry or having them, and some of them actually do have that old like yellow record that they have. And if we can get that scanned to the chart and use that to make a decision moving forward about where they are with the vaccines. So we're going to just change gears a little bit and talk about the HPV vaccine and cervical cancer. So what is that relationship? Basically, HPV infection, human papillomavirus, causes cervical cancer. It's a long-lasting infection with various high-risk types. Those types are HPV 16 and HPV 18, which are responsible for 70% of cervical cancers worldwide. So it's not just having HPV, but being able to identify what are those types that they do have associated, whether or not it's associated with cancer or not. Nearly all people, so it's been said, and I remember decades ago presenting on HPV, it had its own slide deck and so much information, and it was noted that is the most common sexually transmitted disease. So most of the time, by the time people are sexually active for years, they have been exposed to HPV. But again, determining what their type is. Most HPV infections go away on their own. So do people get HPV and are symptomatic? No, most people are asymptomatic. And that's why it's important for my women who are sexually active, when they get a pap smear, to also check for HPV. Because if they do have HPV 16 or 18, they have to be monitored closely to either do a colposcopy, and depending on how the cervix looks and depending on what else is going on with them, have a colposcopy to monitor them over time for cervical cancer. As I mentioned, most of the time the immune system clears it and most people are asymptomatic, but we need to monitor closely and having, again, historic information. Someone might say, patients are like, oh, my pap smear was normal. I'm not sure if they checked for HPV or not. Or they may say, well, I was told to have HPV, but it went away. You want to have that data to follow over time, because if their cervix looks different, if there are different lesions, there's so many things that go into monitoring these women as well as men, as we'll see in the next slide. People who become sexually active at a young age, especially before 18, need to be checked for HPV. So why is there low uptake? Research shows, as with other chronic illnesses, that Black and Hispanic patients, especially with limited English proficiency, receive fewer or weaker provider recommendations. So they may not know to ask for that. They may say, oh, I had a physical and everything was fine. Are you sexually active? Did you have a pap smear? Did they check for HPV? Right? Black and Hispanic parents also report lower HPV vaccination knowledge and intention. And so it's important that they're vaccinated before they actually are sexually active. And so some people, again, are under the impression that they can get it afterwards. Can they get it afterwards? Yes, but it's important that they get it before. And again, with our history of mistrust in the healthcare community as a whole, it's important that education and explaining exactly what is going on and what this is about is explained to the patient so they do understand. Vaccine hesitancy is defined as a person's reluctance or delay in accepting a vaccination. So that in itself is a huge topic, and it just requires a lot of education. Sometimes it's not the first visit, sometimes it's not the second visit, but a little bit at a time, teasing away. And here's some great resources. HPV is important for cancer prevention in men and boys also. My colleague, Dr. Dawson, these are a few resources of papers that he's written in both the Journal of Clinical Oncology, Head and Neck Cancer, and also in May of 2017. And again, great resources that actually show that HPV is associated with oropharyngeal cancer in men and boys as well. Next slide. Here's some resources of the schools that were mentioned, again, in various sites throughout the city, where we have a collaborative relationship and making sure that those students who go to these schools do get regular follow-up and having that information for vaccines. Again, looking at the bottom and just clicking on that link is helpful as well. Next slide. And here are more resources, my vaccine record, many of the immunizations, as I mentioned about the registry, and other sites that are important for updates with guidelines, etc. And if you also look, there's a feedback poll, which hopefully you're completing to be used by the Harlem Health Initiative. Next slide. And on behalf of our team at Ryan Health, thank you for your attention.
Thank you. This information has been so helpful, and we really appreciate your taking the time to do this. Ensley Hops, if you'd like to join us and just give us, we have a few more minutes. We know we're over, but we know that this information is so critical. So I'll decrease so Ensley can talk to you about the resources.
Thank you, Deborah, and thank you both to Dr. Dawson as well as to Ms. Taylor for all of your really valuable information about the vaccines that are required for going back to school. I did want to spend just a couple of minutes at the end I know there's several community health workers, folks from community-based organizations who are attending. So I just wanted to point you to a few resources that the city has made available for our newest New Yorkers. So welcoming newly arrived children and youth. There are still opportunities to enroll these children in school for the 2024-2025 school year. So I just want to point to the New York City Department of Education's Family Welcome Centers. These are open until September 13th. So we still have about a little over 2 weeks that we can be enrolling our newest New Yorkers. And these centers are open Monday through Thursday from 8 a.m. until 5 p.m. and on Fridays from 8 a.m. until 3 p.m. You can make an appointment at the Family Welcome Centers where at these welcome centers, what they'll do is make a determination of which school district you should be zoned into, and give you all of the required information in order to get started with your vaccine and immunization schedule, what types of immunizations are needed. So to make an appointment, the number there is on the screen. And you could also, instead of calling to make an appointment, we can also email to make an appointment. The emails are location specific. So when we send out this information, you can click on that Family Welcome Center's website, and it will link you to the relevant email address, based on the borough. And so just a reminder, students who are living in temporary housing, emergency shelters, they are allowed to enroll in school. They are not at the beginning required to submit any documentation in order to participate in any admission process or enroll in school. So we just want to make sure that we're reminded that all New Yorkers, all New York children, regardless of immigration status, are eligible to be enrolled in our New York City schools. Next slide, please. Fantastic. So once you get enrolled into school, just a reminder as well that New York City schools are also required to translate any school documents that are being provided to a child. And so that is allowing parents to be more involved in their child's schooling, to understand the documents that they're being sent home with. And so there is free written translation of these documents, and there's also interpretation available over the phone through your child's school. So these interpretation services are available over the phone in over 240 languages. Oftentimes we'll see translations that are limited to just a handful of languages that are more commonly spoken, but there are interpretation services for more than 240 languages. So in order to access these, you can call the number on the screen. You can call 311 to ask for translation services as well. But the links that are on the screen here will take you directly to the Department of Education's translation and interpretation services. In addition to that, the health department does offer free language services at all of their New York City community offices and clinics. And parents and guardians, they can either ask for, they can either tell clinic staff of the language that they need interpretation for, or community health workers can also either give an I speak card or even just informally write that down onto a note card that the person can take with them and just show this to the clinic staff, and they are legally required to provide an interpreter. So I'll get into some additional kind of translation and appointment navigation services in just a couple of slides. Next slide, please. So just very quickly wanted to point out the primary New York City Department of Health and Mental Hygiene immunization location is at their Fort Greene Health Center that's located in Brooklyn. And anybody can come here to get low or no cost immunizations regardless of your immigration status. So this is for anyone who's 4 years or older, and they do complete all of the required school immunization vaccines here. An important note is that the Fort Greene Health Center location, they do not provide COVID-19 vaccines, and that's just because there are specific facilities for COVID-19 vaccines. And so if you want to make an appointment, you can either use the link that I've linked here for the appointment, or you can call that number 347-396-7943 if you need assistance in making an appointment at the immunization location. In addition, there are several other community health locations that are noted by the New York City Department of Health and Mental Hygiene as alternative clinic locations. One is our partner, Ryan Health. Their Chelsea Clinton Community Health Center provides many school-based immunizations. And then another location in Staten Island is the Beacon Christian Community Health Center. So those are the primary ones that are advertised by the New York City Department of Health and Mental Hygiene. But I did also want to provide the attendees with some additional resources that our center has put together for you to give some additional information for where you can find health navigators, additional interpretation services, as well as some school programming. So next slide, please. So these are 2 QR codes, and I'm also going to be dropping a link into the chat. These are 2 QR codes. The one on the left is actually going to take you to the database that we have put together that is New York City providers who do provide free or low-cost immunization services, such as our federally qualified health centers. Some provide navigation services, such as like Make the Road New York. They have a fantastic health navigation service to help individuals make appointments, help them get to those appointments, help them with interpretation to make sure that they are understanding everything and are, accessing consent and all of the necessary features of going to the doctor, as well as school-based programming in New York City. There are many organizations who offer after-school programming, after-school mentorship programs, and so we've used our database that we have and we've filtered it to kind of narrow down the results to, I think it's about 50 organizations across all 5 boroughs of New York City that are offering these free or low-cost services. And this is part of our Immigrant Provider Action Center or Impact Center. That's the QR code on the right. The link is also on the screen. And you can go here to access our service provider map. At this map, you can input the zip code of a client. You select federally qualified health centers, for example, as your service provision, and then you could select a radius. So I want a provider within 2 miles, within a half of a mile, and this hopefully will help you find a provider that helps to meet your needs within your local area. So I will stop there. I know we're over time, but I hope that these resources can help direct some clients to free or low-cost immunization services. And please feel free to email me if you have any questions. I will drop my email address in the chat. And that's all I've got.
Thank you, Ensley. And I know we are over, but thank you, Dr. Dawson. Ms. Taylor, you all are absolutely fabulous. And it seems like a lot of the questions that were asked have actually been answered, but we will do this for our audience as we send out the link. We will pull all of the resources and put them into the email and answer any of the questions that we didn't answer fully. Would that be okay with the panelists?
Yeah.
Great.
Yes, fine with me. Yes.
Thank you. I think we're going to have to do a part 2. I think that's really what this is really telling us.
That's a lot.
So I thank you again for your expertise, your time, your talents. Again, this will be a recording. You'll be able to apply for continuing education credits. It will be on our YouTube channel. And a special thank you again to our partners, the Pandemic Response Institute, Can't Be Silenced, of course, our own Center for Immigrant, Refugee, and Global Health, and our beloved providers at Ryan Health. Thank you all for always standing at the crossroads of where our most needed are for resources. Next slide. Really quickly, we have our blood drive coming up. Please, we want to make this a quarterly event and we need your help. New York City right now is at a blood deficit. And in our Harlem community, hospitals like Harlem Hospital desperately need our blood. So please come and join us September 12th and be a part of our blood drive. Next slide. And I'd be remiss if I did not say, please register to vote. Remember to vote. And if you want to volunteer and be part of the day, you can be a poll worker. And all you have to do is fill out the information and you can earn a stipend to support your volunteerism that day. So you'll be hearing more from us around how to register, reminding folks to vote. We have less than 70 days before the presidential election. Here is our social media. You can find us on Facebook, Instagram, our email address, our fabulous newsletter, and our just most recent TikTok account. So please take a moment, get those QR codes, and follow us so that you'll know about the upcoming events. And to our interpreter, Luis, thank you very much. We know that we have been talking fast and throwing lots of information, but without you, we couldn't have done this, and we appreciate your talents in this. Thank you so much. And don't forget to fill out the poll. Thank you, everyone.
Thank you.
Thank you, Priya, who's been back there flipping slides for us and putting this together also. Have a
Correct.
great day, everyone.
Thank you. Be safe.